Meantime, what do you advise people to do? Social distancing? What else?
I think we have to go back to the virus, and I think we have to go and look at the examples, the few examples of healthcare systems which have coped remarkably with this virus. So when we first heard about it in China, there was a lot of criticism, certainly in my media in the UK, of China, but there's always criticism of China in our media. But actually, if we look closely at what China's achieved, it possibly is a modern medical miracle that we've looked at. They've managed to limit the spread of this very infectious agent to less than 1/2 of 1/100 of 1% of their total population. Now, there's arguments about whether they're reporting accurate figures, but they've been actually very transparent. They've actually characterized the disease. They've shared that genome with the world. And that's enabled us to start working internationally on the vaccine even before we'd seen necessarily the infective agent. China recently published a summation of their extensive clinical experience, a document coming from Beijing Hospital University, and they have indicated that they tried several antiviral agents they had on their shelves, including particularly protease inhibitors, which have been effective and are used within highly active antiretroviral therapy used for patients with HIV. So a drug intended for a different disease, but in fact found by the Chinese to be efficacious. And there are some small series of trials coming out also from Korea, from Singapore, which have shown some efficacy of that drug. Now that means shortening the duration of the symptoms, but also meaning that they've shown that a decrease in infectivity, a decrease in the viral particles produced in the nasopharyngeal aspirates of those patients taking those drugs. And that particularly they've recommended lopinavir and ritonavir, which are drugs which are already on our formularies.
Right.
They're not currently recommended by our own medical authorities in the United Kingdom, but we certainly need to be looking to expand those. Perhaps also we should mention that they've used a drug formulated by Cuban scientists, which they've used as an inhaled agent, an anti-TNF alpha agent, is my understanding, which they've also found to be very effective. But I think the most important lesson from China, which we can apply and which we're just unfortunately slowly beginning to apply, were all of the public health measures that they've introduced. They go into great detail about how to organize their hospital. We know that they throw up a hospital in very few days and try to segregate patients with COVID-19 from the general healthcare population who otherwise are elderly and comorbid and would have a huge susceptibility. We also can see from the pictures you're showing now, the levels of infection prevention that they're taking in these photos were not the levels that they initially took, and they're not the levels that we're familiar with seeing, even when we're dealing with cases of infectious disease within our hospital, because it is such an infective agent. We know that initially China suffered because the local hospital workers, including doctors and nurses themselves, became infected, and they've developed extensive protocols for dealing with that infection, for organizing their healthcare system, and for limiting the spread. And perhaps the most overriding feature, which we're really in the UK absolutely failing, in my opinion, to do, and recommended by Dr. Ghebreyesus of the World Healthcare Organization, is extensive testing, which we really, I think, should be rolling out on a far wider scale.
Yeah, extensive testing. And we're seeing some countries who are capable of doing that with smaller populations especially. And it's been really fascinating looking at those insights. Very finally, we're running out of time.